As the world celebrates the 20th anniversary of the World Health Organization Framework Convention on Tobacco Control, Corporate Accountability and Public Participation, Africa, CAPA, is urging the Nigerian government to step up enforcement of the National Tobacco Control Act. Nigeria signed the treaty in 2004 and ratified it in 2005. Enacting the National Tobacco Control Act in 2015 and subsequent regulations in 2019. Despite these laws, tobacco control enforcement in Nigeria remains weak, allowing the industry to exploit regulatory gaps and target younger demographics with new addictive products. CAPA notes that the Framework Convention on Tobacco Control regulates tobacco products to protect future generations from health, social, environmental, and economic consequences. To address this issue, CAPA recommends intensified regulatory measures and full operationalization of the National Tobacco Control Fund, including adequate funding. This implementation also includes robust public health campaigns, funding research initiatives, enhancing enforcement efforts, and supporting alternative livelihood programs for tobacco farmers. Joining us via Zoom for this conversation is the Executive Director, Corporate Accountability and Public Participation, Africa, CAPA, Akimbode Oluwafemi. Good morning. It's good to have you join us on the program.
Good morning.
Now, it's been 20 years of the FCTC, that's the Framework Convention on Tobacco Control, and Nigeria, who also is a signatory to some of the things that were adopted as a result of this, has some acts or laws to addressing these matters. Talk about the National Tobacco Control Act of 2015. We also saw another law put together in 2019. And we are wondering how far we have come with this fight 20 years on of having this conversation.
Thank you very much. First, we must remind ourselves that the WHO FCTC is the first global treaty on public health. The adoption of that treaty, February 27, 2005, has been a watershed in activating Article 19 of the WHO, which mandates it to take, treaties, conventions as measures that can protect global health. And what we've seen since the introduction of that treaty is that for countries that have implemented, strategic provisions of that treaty, seen drastic reduction in smoking and, of course, in health-related problems associated with smoking. Then, when that treaty was adopted, smoking rate globally was about 33%. By 10 years after, it had gone down to about 22%, which it's a remarkable achievement for that treaty. Having said that, just like you have said, in our country, Nigeria, what we've seen is that we've enacted the policies. We have the National Tobacco Control Act 2015, took us years and years for us to get that, and then the National Tobacco Control Regulation 2019. And most recently, actually, the National Film and Video Censors Board, that regulation that actually restricts glamorization of smoking in movies. So for the laws, for the policies that we need, yes, we do have some laws in Nigeria, but we're concerned that enforcement of those laws are still very not at that level and the pace that we wanted. For instance, let's take selling of tobacco products to children. Kids under 18. We've seen researches that have shown us that tobacco products are still being sold near schools. And kids do walk to kiosks where they sell candies, where they sell sweets, and they can pick cigarettes in single sticks. People still send their children to go and buy tobacco products. Ban of smoking in public places. They are hardly enforced except where we've had citizens enforcement. Ban of smoking in restaurants, recreational areas, even schools. These are not properly enforced. And most importantly, taxation has been one of the most effective tools for reducing smoking consumption. The tax rate, the duties on tobacco products in Nigeria is extremely low.
Absolutely.
Way lower than the 70% recommended by the WHO. So yes, we do have some laws, but enforcement we are not encouraged.
Right. So talking about enforcement, I'm wondering what is mitigating against it being having a firm foothold. But for instance, if you look at British American Tobacco, they sued Kenya in 2022 over packaging laws. And then the 2023 stop report cited Nigeria as a hotspot for British American tobacco lobbying. So with Article 5.3 routinely flouted, is the FCTC's enforcement model too Eurocentric to have a firm foothold in Africa as to it working for Nigeria or as corporate capture?
So let me tell you this. I was one of the NGOs representative that actually participated in all the FCTC process from 2000 to 2005, from the intergovernmental body negotiations to the renegotiations. And African delegates stood very firm to shape this convention that we have today, because they realized that Europe, America, all of them do have their national laws that are protecting themselves. But that was a period that tobacco companies were shifting and moving to Africa. And we needed this convention to be able to come to home and convince our government to do something. That the convention can be effectively enforced on the continent. One thing mitigating the enforcement of the law in Nigeria is one of what you said. Because take Nigeria, for example, 37 states, over 200 million people, you need funds. And so the National Tobacco Control Act realized this when it created the National Tobacco Control Fund. And we've been asking government to activate this fund. The law states where you can generate revenue into that fund. Similarly, we are also asking that the Nigerian government should increase taxes on these products. And then from those taxes, you can then fund some of these public health challenges that we have. You can then fund tobacco control activities across the country. If you look at our budget, right? This is 2025. 2023, the entire budget for tobacco control in Nigeria was about 5 million naira. 5 million naira cannot even organize a good meeting in Nigeria Saturday. That was increased in 2024 to just 10 million naira. And we're saying, look, the government can do better. We're talking about the health of the people. So you see, where government budget is where you think a lot of activities can be done. This is a public health emergency to killing about 8 million people every year. 85% of them are from developing countries where our population is. So we expect the Nigerian government to fund this. We expect the Nigerian government through the National Tobacco Control Committee. There is a committee of agencies, parastatals that are concerned with the enforcement of this law to be appropriately funded, capacitated to do what they are supposed to do.
All right. Unfortunately, we do not have time right now. We have to wrap up the conversation here. But a lot has been said already, and we want to thank you, Akimbode Oluwafemi, Executive Director, Corporate Accountability and Public Participation, Africa, for your time on the program. Thank you.
Thank you so much.
Right.